morning and welcome back, Hatters, to Stetson News. Today we'll be continuing our monthly series, A Look Into. This week we'll be having a look into postpartum depression. For this, we'll turn to our news anchor, Elijah Goodman.
Okay, we'll begin with the question, what is postpartum depression? Postpartum depression, or PPD, occurs during pregnancy or after childbirth and creates feelings of sadness, anxiety, depression, and exhaustion that can greatly inhibit their ability to care for their newborn child. Symptoms of postpartum depression typically appear within 4 weeks after childbirth. What are the symptoms? Subtle symptoms is a tendency to overfocus on negative thoughts, desire to withdraw from your baby, partner, family member, and social situations, having extreme anxiety episodes, feeling guilt and shame, recurrent suicidal thoughts. Here's a clip of Camille describing her experience with PPD.
On the outside, I look like any other mom. But inside, I can hear my own voice screaming, "Oh, you can end this. You can. Drive into that wall. Drive into that pole. Drive into that tree." It seems obvious now, but at the time, I simply had no idea that I had postpartum depression. But depression's kind of like that. You think you're fine, and then it creeps up on you like a thick fog, and one of those like bad, low-budget zombie movies. But before you know it, you are one of those zombies, trapped in a distorted version of your own life.
What are the causes? There's still no consensus on the exact cause of postpartum depression. Many believe it is due to hormone levels, but it's hard to tell because postpartum depression doesn't look the same in everyone. What are the effects? Postpartum depression is associated with lower rates of breastfeeding, poorer maternal and infant bonding, and increased likelihood of infants showing developmental delays. If left untreated, postpartum depression can adversely affect a mother's health and might cause sleeping, eating, and behavioral problems for the infant. When effectively treated and managed, both the mother and child benefit. What treatments are available? Psychotherapy. It helps women find ways to understand and cope with their feelings. Therapy also helps mothers solve problems and set realistic goals as they work to manage their postpartum depression. In 2019, the Food and Drug Administration approved the first drug for PPD. Its generic name is Brexanolone. It's given by an IV infusion for 2.5 days. Brexanolone may cause you to feel sleepy, and it can also pass through milk. What is the confusion around PPD? There's a similar condition called baby blues, and it is a common feeling of irritability, worry, fatigue, and sadness during the first few days after giving birth. Up to 80% of people who give birth experience symptoms of baby blues. The main difference between PPD and baby blues is the intensity and duration. Symptoms of baby blues usually resolve on their own within the first 2 weeks after you give birth. They also tend to appear at times, but may not be constant in your day. If the symptoms last longer than 2 weeks or getting worse, you might be starting to develop PPD. Here's a clip of Auburn Harrison's experience trying to receive a diagnosis of PPD.
I called my OBGYN office and asked specifically about postpartum depression, but the nurse told me my symptoms sounded like dehydration. At an urgent care clinic later that morning, an EKG on my heart showed some irregularities in its beat, so the doctor sent us rushing to the ER next door. There, the technician hooked me up to an IV, ordered an MRI, and gave me a CT scan. But before any of these tests took place, a distracted cardiac specialist came into my room and barely glanced at me or my newborn baby before misdiagnosing me with a rare and deadly heart disease called Brugada syndrome. I spent that night in a dark hospital room holding my 11-day-old baby, trying to come to terms with the fact that I was going to die and leave behind my 3 young children.
Ways to self-help would be to sleep as much as you can, save time for yourself, don't skip any meals, and move around. Here's a clip from BuzzFeed.
change.
Being a stay-at-home mom was really isolating, but I felt like I kind of came out of it when I started exercising and hanging out with other moms.
I started feeling better when I could wake up to my baby every morning, and he just makes everything better and everything worthwhile.
To all the mothers going through this, surround yourself with people who get it, because you're not alone.
If you or a loved one has PPD, you are not alone. It reportedly affects 1 in 7 people who've given birth.
Alright everyone, make sure to tune in next month for our next installment of A Look Into. This has been Stetson News at 8. Thanks for joining us. Goodbye.